Hi, my name is Dr. Kerry D'Ambrosio. I'm a senior BodyTalk instructor and practitioner. I'm also a doctor of oriental medicine, an osteopath, and a physical therapist. The purpose of this video is to introduce to you a new class. It's BodyTalk Fascial Balancing. It's going to be the first of a series. We're going to do BodyTalk muscle balancing, joint balancing, fascial balancing, movement balancing, energy balancing. And these classes are going to be part of the new BodyTalk University. First of all, as we talk about fascia, we want to know what fascia is. The easiest way to describe fascia is if you were to get an orange and you peel away the skin of an orange and you're left with that white pith of an orange. If you were to cut that orange in half and look at it, it looks like the spokes of a wheel. And the fruit that it's surrounding, it would be basically your muscles, your organs, your brain, bones, things like that. So basically, fascia is a connective tissue that surrounds your whole body from head to toe, just like in the orange. And it divides your body into sections, just like the orange does. It surrounds every muscle down to the cellular level. It forms the periosteum that goes around the bone. It divides your body into different cavities. It surrounds each organ. It surrounds your neurological structures. It forms a conduit or a passageway for nerves, arteries, and veins to sort of pass through. It sort of forms we call a biotensegrity matrix. Because fascia is interconnected and surrounds the whole body from head to toe, if you were to, let's say, lift your right leg up, you could influence other parts of the body because it's all interconnected. Saying that, if you were to have a right knee injury or an ankle injury or hip injury, as that begins to heal, that would also influence other parts of the body. If we take a look at fascia at the molecular level, it's composed of three things, basically: collagen, elastin, and ground substance. Collagen is a protein. It's a triple helix model, and it's very strong. When you think of collagen, think of something that's strong. It only can be stretched about 5%, its original length. Elastin, think of an elastic band. It's also a protein. It can stretch up to about 150% its original length. So it makes sense. You want tissue that's strong, but also flexible. Now, surrounding all this tissue is ground substance. Ground substance is like a liquidy gel. It kind of binds things together. It's good for shock absorption. It allows tissues to move past each other. Because remember we said the fascia is around organs, it's around muscles. So when you're active, running, playing sports, dancing, it allows things to glide past each other. When you have an injury, let's say you're really upset, you're angry, you're moving around really quickly, and you're not paying attention, and you trip, and you land on your right hip. So you're in a lot of pain. You could be limping for a couple of days. And eventually that pain goes away. You don't realize it, but at the cellular level, you've torn some tissues, maybe some muscle fibers, connective tissue. What your body does is it lays down more collagen, not the elastin, not the flexible stuff, the collagen, because it wants to support the area. We're going to show you slides of this, but when you look on the course, you're going to see that fascia is organized. It's all linear, it's very organized. When we have scar tissue forming as a result of injury, it's going to look like a spider web. It's going to go in all sorts of different directions. Also, the ground substance, which is more or less a liquidy gel, it's going to turn to concrete. It's going to be really solid. And remember we talked about fascia is in this biotensegrity model. So think about it. You've injured this right hip. It's going to create fascial pulls throughout the rest of the body, affecting your shoulder, maybe your neck, the other shoulder, rib cage, different organs. And, let's say this hip, it healed and you go about your life. You're not really feeling the effects. And then something else happens. You injure your left knee or you get into a car accident. You create other fascial dysfunctions in your body. And remember I said that at that time you were upset or angry. What's interesting is that when you get injured, sometimes that emotion gets stored in the tissues, or the consciousness or a belief system gets stored in that. So what happens over time is we accumulate these dysfunctions, and it distorts our posture. It affects our range of motion, how we move our body, okay? And it also creates tension in the body. What this fascia does is it creates a barrier to the movement of vital structures. Blood supply, for example, which has to carry oxygen and nutrition to every cell in the body. It affects the venous return and lymphatic return, which take away the waste products. It's also going to affect the movement of energy, all right, and also nerve supply. And it's interesting, when you have trauma, we have hollow organs, right, like your intestines, things like that, gallbladder and bladder. We also have solid organs, like your kidney, your liver, your spleen, your heart. we tend to injure the yin organs, which are those solid organs, much more because they can't absorb that force as well. And we tend to affect bones as well because there's a high water content in these areas. So we're going to show you that these are where lesions are typically found in these yin organs and also bony structures. Now you might ask, what causes these, fascial tensions that we feel in our body? Well, several things. You can have physical causes or mechanical causes. These could be like car accidents, sports injuries, falls. It can be due to muscle spasms, or you get a burn or something like that. Or it can just be poor posture over time. Your body gets kind of out of alignment. Also, non-mechanical issues, things like emotions and stress, environmental factors can create tension in the muscle, and because fascia is wrapped around that muscle, it creates tension. There's something called a bowstring theory. And if you think of a bow and arrow, think of the shaft of the bow. It looks like the cervical spine, then the thoracic spine, then the lumbar spine. And think of the string in front of it. That would represent all the organs in front of you and the fascia around that. It's interesting what happens is as a body worker, patients come to you with neck pain, back pain, whatever. And typically the people that I teach will go in there and try to manipulate the bones or mobilize them, things like that. But they're not aware of the structures in front of the body. The body is a three-dimensional biotensegrity model. So the organs that sit in front of these areas, if they're holding a lot of emotions, consciousness, or physical injuries, they can create a tight string in front, which creates a tight shaft in that bow. And therefore, these chiropractors or physical therapists or body workers, they go in there trying to loosen up the spine, and they can't. It keeps coming back because they haven't looked inside the front of the body. So when we do the BodyTalk fascial balancing, this is going to give you an edge because we're going to teach you skills to quickly locate where the key areas are. And we're going to integrate it with BodyTalk. So you're going to release everything together. You're going to release the consciousness, the emotion, the belief system, as well as the fascial disturbances. And the cool thing about it is you're going to see the before and after changes. This is where BodyTalk comes alive, because patients are going to come in with certain conditions. We're going to evaluate them. We're going to treat them with this BodyTalk fascial balancing, and you're going to see those changes. So you're going to get really excited. This course is great for anyone out there teaching. If you're a teacher of any of the different courses in the BodyTalk matrix, when you do live demonstrations, this is something that you can add to, let's say, a scar release. If you're a practitioner, out there, you could be, balancing people because of, fears, phobias, personal development, but you're probably going to get patients coming in with headaches or shoulder pains or back pains, things like that. So this class is going to give you a little bit of an edge how to work with these different types of clients. Because remember that most of the practitioners out there are following Cartesian Theory, is that if somebody comes in with a headache or shoulder pain, they're just going to go to that area and work on it. This class is going to be so much different than any fascial class you may have taken before, because most classes out there, they teach you a protocol. They say, okay, work on this area, then work on this area, then work on that area. We're not going to do that. We're going to follow what the body wants. We're going to follow the innate wisdom of the body, the intuition, but also use the BodyTalk process. So you're going to know exactly where to go. And also, we're not just going to work with the body mechanically. We're going to integrate all the different BodyTalk matrix, the emotional release, the conscious release, things like that. This class is only open to people who have started with the foundation, BodyTalk classes. We're going to supply you with a detailed manual. It's going to be highly illustrated, lots of pictures about how to do the techniques. So everything is going to be in the manual. So we hope to see you there soon. Thank you.